Pregnancy week 30. At 30 weeks pregnant, you are well into your third trimester, with just 10 weeks remaining until your due date. The excitement of approaching your due date might come with a mix of planning and some physical discomforts, such as difficulty finding a comfortable sleeping position. This stage is a significant milestone as you and your baby continue to grow in preparation for the big day. You may notice that your baby's movements feel sharper and more pronounced as there is less space for them to move around. You may experience emotional changes during this time, ranging from excitement to occasional anxiety, as the reality of becoming a parent sets in. Week 30 Pregnancy Ultrasound. At 30 weeks pregnant, most uncomplicated pregnancies typically do not require an ultrasound. However, your healthcare provider may recommend that one monitor the baby's growth and overall health. During the ultrasound, the technician measures the baby's head circumference, abdominal circumference, and femur length to estimate weight and track growth progress. The ultrasound also assesses amniotic fluid levels, the health of the placenta, and the baby's position, whether head down, breech, or transverse. The baby's movements, breathing patterns, and overall activity are evaluated to ensure well-being. If there are concerns regarding growth or potential complications, Doppler studies may be performed to check blood flow in the umbilical cord and the baby's heart. You may notice clearer facial features and observe movements such as kicking, stretching, and thumb sucking. The baby's heartbeat typically ranges from 120 to 160 beats per minute. If you opt for a 3D or 4D ultrasound, you will experience a more detailed view of your baby's face and movements. These types of scans are primarily for bonding rather than diagnostic purposes. If you're expecting twins, they may grow at a rate similar to singletons at this stage, but you might notice that their growth slows between weeks 30 and 32. Your OB may recommend a biophysical profile combining an ultrasound with a non-stress test, NST, to monitor the baby's heart rates and contractions. If the results are normal, concerns about fetal distress or preterm labor can be ruled out. Week 30 Size of the baby. At 30 weeks pregnant, your baby is about the size of a cabbage. The average fetus at this stage measures approximately 15.7 inches in length and weighs around 2.9 pounds from head to toe. Week 30 Baby's Development. At 30 weeks pregnant, your baby's major body systems are fully developed, and they are rapidly gaining weight in preparation for life outside the womb. They have grown a significant amount of hair on their head, and their eyes can now open wide, allowing them to begin distinguishing shapes around them. As the baby gains weight, their skin becomes smoother due to increased fat stores beneath the surface. This fat helps regulate body temperature and is an important energy reserve for the developing brain. Around this time, the baby starts to shed lanugo, the fine hair that protects their skin, and vernix, a waxy substance that begins to disappear. Although space in the womb is limited, your baby is surrounded by about 1.5 pints of amniotic fluid, which allows for movement as your belly expands. Their skin cells also produce melanin, the pigment responsible for skin color, although their complexion will fully develop after birth. Your baby has regular sleep-wake cycles, marking this crucial time of growth in preparation for the journey ahead. Week 30 Pregnancy Belly. At 30 weeks of pregnancy, your baby bump is quite noticeable, as your uterus has risen about 4 inches above your belly button. The growth of your bump may lead to a feeling of heaviness in the uterus, which can pressure your stomach and diaphragm. The shape and size of your belly can vary based on factors such as your body type and whether this is your first pregnancy. You may also notice a dark vertical line, known as the linea nigra, appearing down the center of your belly due to hormonal changes. Stretch marks may develop as your skin stretches to accommodate your growing baby. As your pregnancy progresses, you might feel tightness and itching in your belly, which can often be alleviated using moisturizer. Expect to feel regular kicks, jabs, and rolls from your baby, as they have less room to move around. You may also experience Braxton Hicks contractions, which can cause temporary tightness in your belly. During checkups, your healthcare provider will measure your fundal height, typically around 30 centimeters at this stage, and usually corresponds to the number of weeks you are pregnant. Week 30 Pregnancy Body Changes. At 30 weeks pregnant, your body adjusts to support your growing baby. You may need to visit the bathroom more frequently, and due to the added pressure on your bladder, you might experience bladder leaks. Engaging in pelvic floor exercises can help you manage these changes. Swelling in your feet and ankles from water retention is common during this time. Staying hydrated and wearing comfortable shoes can help alleviate discomfort. However, if you notice sudden swelling in your face, hands, or feet, it's important to consult a healthcare provider, as this may indicate potential risks for preeclampsia. By this stage, you may have gained between 18 to 25 pounds. Those expecting twins might gain approximately 1.5 pounds per week during the later trimesters, which helps nourish your babies, support the placenta, and accommodate increased blood volume and amniotic fluid. You may also experience increased breast sensitivity and possibly leakage of colostrum, which indicates your body is preparing for breastfeeding. As your due date approaches, you may experience increased emotional stress, anxiety, and vivid dreams. Discussing these dreams and using relaxation techniques, such as massages, soothing music, or prenatal yoga, can help ease anxiety. It's also essential to rest whenever possible to maintain your energy levels during this final pregnancy stretch. Week 30 pregnancy symptoms. 1. Shortness of breath. As the uterus expands, it can press against the diaphragm, causing a feeling of breathlessness, especially during physical activity. 2. Belly button changes. Your belly button might protrude or shape as your stomach stretches. 3. Fatigue. The combination of physical strain and emotional changes can leave you feeling more tired than usual. 4. Brown discharge. Changes in vaginal discharge, such as brown spotting, can occur, which may be normal but should be discussed with your healthcare provider if it concerns you. 5. Heartburn and indigestion. Your expanding uterus puts pressure on your stomach, which can cause heartburn and indigestion. 6. Mood swings. Hormonal fluctuations can trigger intense emotions, leading to feelings of irritability, anxiety, or sadness. 7. Leg cramps. You may experience sudden, painful cramps in your legs, particularly at night, due to changes in circulation and pressure on your veins. Week 30 pregnancy checklist. 1. Arrange care for pets and siblings. Organize care for your pets and older children before labor begins. Reach out to a trusted friend or find a local pet sitter. 2. Learn about newborn screening tests. Contact your hospital to learn about their standard newborn screening tests. This can ease your concerns and prepare you for your baby's first checkup. 3. Practice your hospital run. Plan your route and time your journey during peak hours. Prepare alternative routes for unexpected traffic. 4. Book a pregnancy massage. Treat yourself to a relaxing massage to ease muscle tension and improve circulation. 5. Research doulas. Explore the benefits of hiring a doula for your birth. They provide physical and emotional support during labor and advocate for your birth plan. 6. Consider cord blood banking. Look into cord blood banking, which stores your baby's cord blood after delivery for potential future medical treatments. 7. Plan for maternity pictures. Consider organizing a photo shoot to capture memories of your baby bump and explore various photography styles. Week 30 pregnancy tips. 1. Install car seat. Ensure you have a safe baby car seat installed correctly for your first trip home from the hospital. 2. Get omega-3. Boost your diet with omega-3 fatty acids for your baby's brain development. Include fatty fish, flax seeds, or high-quality fish oil supplements in your meals. 3. Get vaccinated. Protect your health and your baby's by getting essential vaccinations, such as the flu shot or Tdap vaccine. 4. Start packing your hospital bag. Gather essentials for you and your baby, including toiletries and comfortable clothing to help you feel at ease. 5. Organize important documents. Keep your insurance information, hospital registration papers, and prenatal records easily accessible. 6. Choose comfortable shoes. Invest in supportive shoes during pregnancy to reduce discomfort. Avoid heels and tight footwear to manage swelling and maintain stability as your center of gravity changes. For more videos like this, please like, share, and subscribe.